Good morning, good afternoon, and good evening, wherever you're joining us from. It's truly a privilege to open the 2024 UHC Day Campaign Annual Town Hall. Before we get started, let me ask, or actually provide a little bit of information in terms of making the webinar work most effectively for you. As you typically have probably done, we want you to make sure that you have interpretation options that you're clicking on. At the bottom of your Zoom screen, you'll see a picture of a globe, and that gives you the option to select interpretation. So we have French and English. We also have international signing available, and then we also have closed captioning. So you can take one of those options, whatever your needs might be. If you don't see it in the particular box, go to the three dots where you will also see additional options. We also ask that you stay muted if you are not speaking. We encourage you to put questions in the Q&A box, and then at the end we'll be able to respond to some of those questions, and also you may raise a hand depending on the time that we have remaining so that we can call on you. So we're very excited to get started today on this webinar. As you know, tomorrow is UHC Day, and we are very excited to start with this town hall today. The event is hosted by UHC 2030 in collaboration with WHO, IPU, CSEM, and IFMSA. And so we are bringing together powerful forces for change today, the voice of youth and the commitment of our parliamentarians, two critical constituents as we think about implementation of the goals of UHC. I'm pleased to be with you today as one of the co-chairs of UHC 2030. My other co-chair, Dr. Magda Robala, was not able to be with us today. But we're going to confront one of the most pressing issues as we continue to pursue action, implementation, and accountability for universal health coverage, and that is financial protection. Today, we focus on the critical reality that too many people worldwide are being impoverished by the costs of accessing healthcare, while many others forego or delay essential treatment due to financial barriers. We know that the numbers are staggering. Over 2 billion people face financial hardship due to out-of-pocket health costs. And already 344 million are in extreme poverty. And in addition, we know up to 1 billion people are further pushed into poverty or experiencing even greater poverty. And these are not just numbers. These are people who must choose between a visit to the doctor and putting food on the table. I see children whose potential is stifled by preventable illnesses and women who delay life-saving care because of the cost. So this is not just a health crisis, it's a human rights crisis. And we know that UHC is a promise to everyone everywhere that they'll have access to healthcare that they need without suffering financial hardship. It is really the cornerstone of equity, justice, and resilience in society. And yet, financial protection has deteriorated in 70% of countries over the last 2 decades, even though we may have seen provision of services increase. I want to underline the theme of this year's UHC Day. Health, it's on the government. It's a powerful reminder that achieving UHC is not just about aspirations. It's emphasizing action, accountability, and leadership. It's also a call for action for all of us, parliamentarians, youth advocates, and global leaders. As we gather today, we have 3 objectives. First, to highlight the urgency of removing financial barriers to healthcare and ensuring financial protection for all. 2, to inspire and empower advocates, especially young advocates, who are not just the future, but also present in the UHC movement. And 3, to mobilize parliamentarians, our colleagues, highlighting their pivotal role in shaping inclusive policies, passing equitable budgets, and protecting people from health-related poverty. So we want to say to our parliamentarians, your leadership is essential. The laws and budgets you create have the power to transform lives, ensuring no one is left behind or pushed further behind. And to the youth advocates, your voices are a powerful force for accountability and change, reminding us all of the stakes and the urgency, not just now, but for the future. This town hall is a space for frank dialogue, shared learning, and collective commitment. I encourage each of you to engage fully, listen deeply, and collaborate creatively. Together, we can accelerate progress toward UHC and ensure that financial protection is not just a hope, but a reality for all. So let's get going. Let's get to work. It's now my pleasure to move us into our first segment. To set the stage for today's discussions, we're privileged to have perspectives from global leaders. First, we'll hear a message from Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, not a stranger to any of you. So if we could please have Dr. Tedros's message.
Distinguished participants, youth advocates, and honorable parliamentarians, dear colleagues and friends, in the Sustainable Development Goals, countries committed to achieving universal health coverage by 2030. And yet today, half the world's population lacks access to essential health services. And over 2 billion people face catastrophic health costs. And while service coverage has improved, financial protection has worsened in 70% of countries. These are not just statistics. They are families forced to sell their possessions to afford care, parents choosing between buying medicine for a sick child or putting food on the table, and individuals who forego life-saving treatment because they cannot afford it. The theme for UHC Day this year is health. It's on the government. We call on all governments in all countries to translate their commitments into concrete laws, policies, and budgets that protect people from financial hardship and ensure access to essential health services. These reforms will not only safeguard health, but also drive economic and social progress. Thank you all for your commitment to advancing UHC around the world. As young people, you're not just advocates, you're future leaders and decision makers. Your voices must be heard because the decisions made today will affect your health tomorrow. WHO is committed to working with you to make health for all a reality for everyone, everywhere. I thank you.
We thank Dr. Tedros for not only his inspirational words, where he once again has reinforced the realities of achieving UHC, and also making that call for concrete action for laws, policies, and reforms and budgets that will allow all of our countries, all of our nations to move closer to the goals of universal health coverage. Next, we'll hear a message from Dr. Martin Chongung, Secretary General of the International Parliamentarian Union.
Dear Mr. Director General, dear Dr. Tedros, honorable members of Parliament, ladies and gentlemen. On behalf of the Inter-Parliamentary Union, the global organization of national parliaments, I am delighted to address you at the beginning of this virtual town hall. I wish to thank our partners from WHO and UHC 2030 for their leadership and commitment in promoting parliamentary engagement and closer links between parliamentarians and youth on universal health coverage. Thank you for coming together today to mark Universal Health Coverage Day. This annual event serves not only to celebrate progress, but also to address the challenges we must overcome to ensure that health truly becomes a right for all, not a privilege for a few. The IPU member parliaments took a landmark step in 2019 by adopting the first global parliamentary resolution on UHC. My dear brother, Dr. Tedros, witnessed the adoption of this resolution in Belgrade. It was a powerful statement recognizing that health is at the heart of development and equity. However, resolutions mean little if they remain on paper. The Interparliamentary Union, in partnership with WHO, has been actively promoting implementation of the resolution. We have seen that parliaments have taken action in different ways by elevating UHC to the top of national agendas, by promoting stronger health legislation, and by overseeing health expenditures. Today, as we take stock, we must recommit to transforming those words into action. We share the conviction that health must be reframed not as a cost, but as an investment in our collective future, and no one knows that better than young people. Investing in health is investing in people and giving communities the ability to thrive and prosper. Parliament's public engagement is vital to understanding the lived realities of people. Only through meaningful engagement, through a two-way dialogue, can parliamentarians craft solutions that respond to real needs and contexts. You, the youth, play an essential role. You are the voice of innovation, resilience, and the generation that will inherit the outcomes of our action or inaction. Today's town hall represents a unique opportunity for parliamentarians and youth to share ideas, concerns, and visions. I hope you will have a frank discussion on the barriers that stand in the way of UHC, in particular the inequalities that leave the most vulnerable behind. Together, we can drive change. The road to UHC is not easy, but it is the only path to a fairer and healthier world. I wish you fruitful discussions, and thank you.
A big thank you to Secretary General Chung Gong for emphasizing the role and responsibilities of our parliamentarians in advancing UHC. He certainly is welcoming the dialogue and exchange with our youth and emphasizing once again something that we all believe in, which is investment in health is an investment in all of our futures, and particularly for the youth to be sure that our societies thrive and prosper. Finally, in this segment, it's my pleasure to welcome Ms. Sobhita Gautam, Nepal's youngest elected parliamentarian and a trailblazing advocate for health equity, as well as, I want you to know, she was voted as 2023 One Young World Politician of the Year, pardon me. And so, Sobhita, the floor is yours.
Thank you so much. Hello, everyone. It's an honor to join you today to discuss a very critical issue of universal health coverage. And I'll be sharing the Nepalese context today. So Nepal's journey towards achieving universal health coverage is very deeply rooted in the principles that are enshrined in our Constitution of Nepal 2015, which guarantees the right to health, equality, non-discriminations, social justice, etc., as fundamental rights. And this principle guides our commitment to providing healthcare that is accessible, equitable, and affordable for all. To accelerate the progress towards universal health coverage, we have also adopted multifaceted approach. First, the financial protection and equity are at the heart of our strategy, I say, because the National Health Financing Strategy aims to reduce out-of-pocket healthcare expenditure by promoting social health protection mechanism and that targeted subsidies for the poor and the marginalized, along with the increased investment in the health sector, are helping us to build sustainable and inclusive health financing system. Second, we are working to expand access to quality healthcare, particularly in remote areas. Through our 15th plan, we aim to reduce maternal and neonatal mortality rate and improve life expectancy by strengthening primary health services, ensuring skilled birth attendance, and improving antenatal care are key components of this strategy. And third, we are addressing a critical challenge, uneven distribution of the human resources for health. Our national human resources for health strategy ensures that skilled health workers are equitably distributed across all levels of the government, enabling even the most remote communities to access quality care. And fourth, we also recognize the need to bridge the health disparities caused by the poverty, gender equality, and the geographical barriers. As you know, like Nepal is geographically very difficult country. We have high mountains, hills, and the plain areas. So it is very important to address the geographical barriers. So equity-based planning supported by the disaggregated data allow us to take vulnerable populations, including women, people with the disabilities, and the socially excluded groups, especially those people who are living in the remote areas and geographically very difficult areas. And fifth, I think access to affordable medicine is also very important, and that is also in our national priority. Nepal's pharmaceutical industry is also growing, and it is not enough to supply within the country, but it is growing, I say. So we are strengthening local production to reduce reliance on the imports. We are also planning, few companies are planning to export the medicine in the major destination like Europe and America as well, but they are on pipeline. So at the moment they are growing. And at the same time, robust regulatory framework are being implemented to ensure the quality and affordability of the medicines. Few approaches like telemedicine are also in line to be executed soon to address the health concern of the people at the worst case, because as I said before, Nepal is geographically very difficult country, and in many cases it is very difficult to reach for the people to reach to the hospital in city areas or in the it is very difficult for people to reach to the hospital. So maybe telemedicine is also a best option at times in the worst case, and that is also in discussion. And I think in near future, it will be in practice and it is in the pipeline. So yes, despite our progress, challenges always remains. High out-of-pocket expenditures, gaps in the quality services, and inequities in the healthcare access are persistent issues, and we must continue to strengthen our health system, foster partnership, and focus on reaching the most vulnerable population. And as a young member of parliament, I have personally witnessed the transformative power of the youth voices in decision making. Youth bring energy, innovations, and the deep understanding of the challenges facing our generation. In Nepal, we are actively engaging youth leaders to shape policies that reflect their aspirations and priorities, particularly in healthcare. We are everywhere, but especially healthcare is our major concern, as it is a very important topic in Nepal and Nepalese context. So, ladies and gentlemen, presenting here today, I think achieving universal health coverage is not just about policies and the programs. It is about building a just and inclusive society where every individual has the opportunity to lead a healthy and dignified life. And together, let us make a commitment to this shared vision and work collectively to ensure that no one is left behind. So this is from my end. Thank you very much.
Thank you, Sobita, not only for sharing your insights on the Nepalese context of care about, creating sustainable and stronger health systems, addressing access, particularly for those socially excluded, and in remote areas, and tackling really critical current health issues such as maternal and child health and mortality, but really that commitment to also addressing financial protection. So your comments are inspiring to us, and we hope it also inspires others to become politicians who represent youth. And again, a power of that youth voice in driving progress. So thank you so very much. Next, we're going to move to a panel discussion to hear from country level experiences on financial protection. We're going to start with our first panelist, who's going to tell us what works, what doesn't work, and the way forward. So I invite Beatrice Okesh, Advocacy, Communications, and Campaigns Manager at AMREF, to share her insights about financial and other barriers young people face when accessing healthcare, and her calls to action for both youth and parliamentarians. So if we could give the floor to Bea, that would be outstanding. Thank you.
All right, thank you so much, esteemed parliamentarians, partners, and fellow youth advocates. It is an honor to be here today to discuss a matter that is super close to my heart, which is the challenges that young people face when accessing healthcare. I stand firmly by the belief that adolescents and youth are the cornerstones of our present and our future, and the well-being of young people is directly linked to the well-being of societies at large. Therefore, universal health coverage is not just a goal, it is a necessity for building a just and equitable society. When we ensure that young people have access to quality healthcare, we lay the foundation for a healthier, more productive future for everybody. Yet, many of us, especially young people, are still struggling to achieve this fundamental right. Young people continue to face insurmountable challenges when it comes to accessing healthcare. One key challenge amongst these is financial barriers. Millions of young people across the world face crippling healthcare costs. And according to the World Health Organization, approximately 930 million people spend more than 10% of their household income on healthcare each year. For young people, many of whom are unemployed, students, or in precarious jobs, even smaller costs can be insurmountable. It is not uncommon that many young people often avoid seeking medical care altogether just because they can't afford the consultation fees or the cost of medication. And this is a stark reminder that this isn't just about the immediate financial burden, but it's also about the long-term impact on our health, our education, and our future. So financial barriers are just one part of the story. Structural barriers like the lack of nearby health facilities or youth-friendly services further alienate us. The PMNCH What Young People Want campaign surveyed over 1.5 million youth and found that we consistently prioritize access to comprehensive and affordable health services. Yet these services remain out of reach for so many of us. Social barriers also play a significant role, with many young people facing stigma when seeking care for issues such as sexual and reproductive health or mental health. So for instance, depression is the leading cause of illness and disability among adolescents, yet mental health services are frequently unavailable and unaffordable. So before I usher my call to our parliamentarians here and worldwide, I would like to take a moment to speak to my fellow young people. I urge us to continue to join the movement for change, despite the various challenges that we face. Our voices matter. Let us engage in campaigns and advocacy spaces, breaking down silos and breaking down barriers, such as the What Young People Want campaign, and advocate for the agenda for action for adolescents. By working together, we can make meaningful contributions to shaping policies that reflect our needs, demand accountability, collaborate with other youth-led organizations, and use platforms like social media to amplify our voices. To the esteemed parliamentarians amongst us today, we look to you as allies in the fight. You have the power to eliminate the barriers that we face. But before I share my recommendations with you, I want to emphasize the cost of inaction of not investing in adolescents and young people. According to the adolescent investment case over the period of 2024 to 2050, the average cost of inaction, that is benefits foregone, has been estimated at USD 110 trillion, which is approximately $4.1 trillion every year. And this equates to 7.7% of the GDP of the countries in the models, which covers about 80% of the world's population. There are strong reasons why sustainably increased investment in programs to promote adolescent well-being are both urgent and fully justified. Such investments also make excellent economic sense, with a large number of interventions across multiple domains of adolescent well-being yielding returns of at least $10 for every US dollar invested. This investment must be across sectors to cover all aspects of adolescent well-being, and it must meet the context-specific needs of adolescents and have opportunities for them to contribute to design and development of programs for them. Failing to invest in the well-being of young people will result in a future that is burdened by preventable diseases, lower workforce participation, and higher healthcare costs. The cost of inaction is not just a missed opportunity, it is a significant drain on national resources that could otherwise be invested in building resilient and thriving societies. Therefore, I call on you to enact financial protection laws and expand public health budgets to subsidize or make essential healthcare free for young people. Focus on preventative care and mental health, which are often overlooked but very critically needed. We also call upon you to create policies that resonate with the needs of young people. This means implementing the principles of meaningful and inclusive youth participation in your policymaking processes. Engage with us, not just as beneficiaries, but as equal partners to the future that we want. Finally, we ask that you work with young people and youth-led organizations to co-create solutions and ensure that budgetary allocations for health programs are transparent and effectively implemented. And I know that the path forward isn't easy, but together we can achieve a healthcare system where no young person is left behind. I believe in the power of partnerships between parliamentarians and youth advocates. Together we can make a UHC a reality for all young people, ensuring that we're not just addressing today's challenges, but we're building a healthier, more equitable future. And finally, I urge parliamentarians to remember that many of your electorates at the moment are young people, particularly in the global south, where the youth population is burgeoning. Prioritizing our health agendas is not just an investment in the next generation, but a response to the needs of your constituencies today. By listening to and addressing the issues that matter to us, you strengthen the trust between young people and their governments, paving the way for a brighter and healthier tomorrow. Thank you very much.
Thank you, Bea, for not only highlighting the critical challenges of access to care for youth, but also the financial barriers. And we know that, as you've indicated, individuals will forego care and certainly medications if they can't afford them. I think what's most important that we've heard from you, it is the investment that is so important that we cannot afford the cost of inaction. So we really must be able to remove the structural barriers to the financial issues as well as the delivery issues, but also your call to action for that joint dialogue, and that we want youth to be in contact with our parliamentarians, because together working on these issues, that's where we're going to see the solutions that you've said very strongly need to be co-created. So thank you very much for that. Our next panelist is the Honorable Fauzia Khan, Member of Parliament from India. Honorable Khan, would you please speak to us about India's recent reforms in health financing and insurance schemes as you've addressed financial hardship, especially for young people? Honorable Khan, the floor is yours.
Thank you very much. And I'm extremely happy that I'm part of this very important discussion. And I'm proud to be speaking about my country and the schemes that India is now going through. Considering the challenge of its immense population, India has forged ahead quite strongly in the health sector. Government-run health centers are established in every nook and corner of the nation. Although there's no doubt that we still have a long way to go, so challenges exist. But considering the geographical disparity and the immense area and the population, I think we have done quite well. Healthcare access to the young and adolescents is extremely important. And that's why this subject is so very important for us, is because the entire progress of any nation of the world, for that matter, is based on the health of young people. Because, and particularly the young females, if I have to be more specific in that, because everything depends on the health of young girls, young adolescents, when it is related to their
I'm afraid we've lost Honorable Khan.
I see her rejoining just now, so hopefully she's able to.
Okay, so maybe you can just give her a second to reconnect.
Yeah, I'm sorry. Am I audible now?
Yes, we can.
Please.
Okay, I'm sorry, I lost connection. So I was speaking that the healthcare access for young people is very, very important. Now, as far as India's progress is concerned in this sector, its robust community health programs that have made a difference are, I'll relate a few. One very unique scheme that we are following, the system is, we have Anganwadi workers and we have Asha networks in every village. So we have lakhs of villages, and in all these villages, we have these Anganwadis, which look after children from 0 to 3 years. And we have one Asha, who's a health worker. So she coordinates between the health sector and the village. With over 9.83 lakh Ashas and 13 lakh Anganwadi workers, these programs intend to primarily address malnutrition, maternal mortality, child development, and women empowerment. So because of this, child mortality rates have grossly been reduced. Nutritional outcomes have increased to some degree, though challenges remain, including inconsistent remuneration to these frontline workers. So although we have a huge network, there are some issues which still need to be resolved. We have the Janani Shishu Suraksha Karyakram, which offers free maternal and child health services benefiting millions of young mothers and children. We have the Rashtriya Bal Swasthya Karyakram, which screens children for birth defects and developmental delays, targeting over 1.7 million cases annually. We have the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, where you have generic drugs available in 13,822 outlets, where poor people can procure drugs at very, very minimal rates. And we have this insurance scheme, which is called Ayushman Bharat Yojana. This is the world's largest health insurance scheme, covering 55 crore individuals and offering 5 lakh per family annually. We also have the Ayushman Bharat Digital Mission that establishes electronic health records, simplifying access to healthcare services, and vaccination rates have improved because of our mission Indradhanush. So these are the positives that I wanted to relate about the schemes that we have adopted. But there are several issues that need to be addressed. And among them are access to reproductive health services by young women, which is hindered by stigma
I think we've lost Honorable Ken again. When we had her video and voice on, I suggest we just give her a minute to rejoin. Honorable Ken, you're back on. Over to you.
I'm really sorry. I'm losing connection again and again. Anyway, I was talking about the issues which need more focus now, and among them, menstrual health initiatives are important because menstrual hygiene scheme faces some inconsistent outreach. We have mental health services, but these still remain underfunded and limited. India has the largest number of anemic populations in the world and an increasing trend between 2015 and to 2021. Now, this is very important because if you have to care for adolescent and young children's health, then you cannot afford to have anemia to this degree. So for this, iron and folic acid supplementation across all life stages is being disbursed. Unfortunately, as per the National Family Health Survey 5, 2019 to 21, 31.1 of adolescent boys and 51% of adolescent girls in India are anemic. A 2022 study has found that 28.5% of Indian adolescents aged 10 to 19 are anemic. So I think this is a big concern and this needs to be addressed. India's public health expenditure is between 1.2% to 1.6% of the GDP. And I think this is something which we have to look into. In rural areas, particularly, there's the issue of insufficient beds. There's the issue of sanitation. There's an issue of electricity in primary health centers. And what is needed, especially within the framework of the insurance scheme that I was talking of, we need to take in rehabilitative and palliative services, and these need to be strengthened because when a person is bedridden, the out-of-pocket expense increases tremendously. And India's out-of-pocket expenses on healthcare still hover around 50% of the total health expenditure. So a huge number of people are being pushed into poverty because of this. And we need to somehow see that this out-of-pocket expenditure reduces and the healthcare that we provide, access is there, but we need to make it more qualitative. We need to make it more effective. And these are the challenges. Additionally, awareness about government health schemes remains low among the youth, leading to underutilization of available services, particularly in marginalized and remote communities. I'm talking more about the areas that are in the rural sector. When we come to the urban sector, the problem is obesity. Obesity has increased tremendously in the urban areas in the children and youth because of the quality of food. And India has the highest number of people living with diabetes, earning it with the title of diabetes capital of the world. So one more thing where India has made significant progress is combating HIV and AIDS through innovative programs and strong partnerships. So the opportunities that we have and that we will be advocating for in our own country to achieve equitable healthcare for India's youth is to increase public health funding, to expand outreach and education, to enhance workforce support, to integrate IT systems, technology, and telemedicine and other things for the connectivity, address social detriments of health like focusing more on education, nutrition, vocational training to empower youth. Because as per the definition of the World Health Organization, universal healthcare includes promotive, preventive, curative, rehabilitative, and palliative health services, which are required to be affordable, of sufficient quality and good quantity, while also ensuring that the use of these services does not expose the user to financial hardship. We are aware of these issues, and we need to focus more. The government is also trying to do better and better, but what is needed is more budgetary provision in the health sector, and that's the secret of everything. At the end, I'll only say India's youth hold the key to a prosperous future. By addressing these challenges and scaling successful reforms, we can ensure that no young individual is left behind in the pursuit of health and well-being. Thank you very much.
Thank you very much, Honorable Khan, for sharing those programmatic improvements that you're all working on. I think one of your last comments that it is the finances that are absolutely critical. And thank you for welcoming the voice of youth to be able to continue to not only improve the messages, but really seek that accountability in partnership with parliamentarians. So thank you very much. We'd now like to move to this section of our webinar this morning as a celebration of youth advocates. As you know, youth, as we've been saying, are the heart of the UHC movement. And in this segment, we're going to celebrate outstanding advocacy of young leaders who have mobilized their communities already for action on UHC. To begin, I invite Diego Bustos Castillo, External Affairs Regional Assistant for the Americas with IFMSA, or medical students, to share what it means to be a youth activist for UHC. Diego, over to you.
Thank you very much, Dr. Cipriano, distinguished guests and future colleagues. Thank you for considering me to address this question and for the honor of speaking alongside global health leaders whose passions inspires us all. This topic is deeply personal to me. I was raised in a middle-class family that instilled in me the belief that the privilege of access to education, food security, and a private space to rest comes with an inherent responsibility. Inspired by years of observing the socially conscious leadership of my father and grandfather, I chose to study medicine and aspire to lead by example. However, this journey often comes with challenges. Raising awareness invites criticism, a challenge I embrace, and I know you all embrace, with enthusiasm. I relish engaging in debates with those who question evidence-based approaches. Alarmingly, we see a rise in influential entities undermining health equity with baseless arguments. For instance, the myth that a welfare state bankrupts government is fundamentally flawed. On the contrary, impoverishing health costs rob families of their future. By ensuring health for all, governments make a strategic investment in equity and opportunity. This Universal Health Coverage Day, I urge leaders to build healthier societies where everyone thrives, free from the burden of financial hardship. With that being said, a young activist for universal health coverage, for me, must balance the demands of advocacy with concern for the safety and well-being of their peers. It requires patience and resilience, and this is a long and arduous journey, but one we embrace with determination. As I have often stated in my role within the International Federation of Medical Students Association, IFMSA, medical students worldwide possess significant power, both as the future healthcare workforce and as leaders. To my fellow medical students here and aspiring youth activists, my message is clear. Here are problems, solve them. Here are our opportunities, seize them. Here are our fears, ease them. Here are our dreams, help them come true. Thank you.
Pam, you're on mute. Pam, you're on mute, please.
Yeah, thank you, Diego. We hear your passion and commitment. I want to turn next to Dr. Mariam Jashi, a former parliamentarian and global health leader, to share her experiences with youth. So, Mariam, our question for you is, as a former parliamentarian, can you tell us about your personal experience with youth activists? What role have they played in your parliamentary experience, and what impact have they had?
Thank you, Pamela. And first of all, it's wonderful to join the inspiring young leaders who I'm sure will shape the global health future even further and surpass, of course, our successes. First of all, as the Georgian politician and the former parliamentarian, I cannot speak today without mentioning that if you look at the Georgian news today, you will see how our young people are fighting for protecting democracy, human rights, and the European future of our country. So that is exactly the example of the voice and power that young people bear in each of our communities. And I'm grateful to them for their bravery and heroism, truly. As for the experience of young people's engagement in policymaking, let me bring you two examples. First is related to universal health coverage. 12 years ago, less than 50% of Georgian population had access to basic health care. 99% of the households were driven into poverty due to catastrophic out-of-pocket payments, and over 70% out-of-pocket payments were the baseline where Georgia started its universal health coverage journey. But due to the political commitment, due to doubling of the health sector investments, in less than 4 months of the reform, we have expanded universal health coverage to more than 90% of the population, including all age groups and young people. And that was truly a success that we will be all proud of. However, since Georgia was a middle-income country, and most of the resource-limited countries have limitations on financial resources, still, despite doubling of the universal health coverage budget, the 150 USD were per capita investments for the initiative. Of course, high-cost treatment and diagnostics were still not available, and one of the most critical areas were pediatric oncology. Oncology diagnostics, treatment, and high technology interventions like bone marrow transplantation, that was truly driving families affected by this disease into poverty. They were selling their houses, everything that families had when the child or a young person was diagnosed by cancer. So, since we didn't have possibility to increase financial investments from domestic budgets, what we did, and I was the author of the initiative and core founder of the initiative under the Prime Minister's office, we established the National Solidarity Fund of Georgia that was based on innovative financing. We were collecting micro donations and micro philanthropy from 60,000 civil servants and more than 500 private sector representatives and individuals countrywide. And in less than 2 years, there was no child or young person who would have lost his or her life due to unaffordability of quality oncology treatment, both in Georgia and abroad. And children and youth affected by cancer and their families have been closely collaborating with the ministry and parliamentarians for finding the joint solution for the better outcome. Due to the time limitations, I will keep my second example for further interventions, Pamela, but this was truly a success story that was co-created by children and young people, their families, and the policymakers.
Thank you, Dr. Joshi, especially for sharing that outstanding outcome. That is a wonderful example of how joining these voices can be extremely powerful. Let me come back to Diego and ask another question. So you've concluded your remarks talking about problems, opportunities, fears, and dreams. Maybe expanding on that, my question for you is, what is your call to action for other young people? Put that into your message that is very realistic and say, what should people do next? What should our youth do next?
Let's be practical about it. I think it's important to to be that like that. So with regard to achieving health for all, my call of action for other young people, it's that first and foremost, we must acknowledge the reality of our global leadership crisis. Democracies are being questioned, anti-vaccine movements are gaining momentum, financial protection have eroded in 70% of countries, and increasing numbers of people are falling into poverty. It will ultimately fall to a new generation of universal health coverage activists to develop strategies that address these pressing issues. But let us embrace the notion that imagination is its own form of courage. So let's be practical. First, be the leaders who embody genuine and legitimate frustration with a failing system that does not protect its people. You will find that an overwhelming majority are eager to rally behind those who inspire change. Second, raise public awareness through protest, but remember that activism must translate aspirations into concrete policies and institutional reforms. After all, this is why we are convening in this parliamentary town hall. 3, understand the levels of governments that hold the greatest influence. In other words, know your audience, as there is little value in engaging with those unwilling or unable to effect change. And 4th, reject the false dichotomy between protest and politics. Embrace both. This platform gives me hope, and addressing this question is deeply meaningful to me. In my country, as a future president of a national member organization of medical students, I witness daily the challenges we face: apathy, unmotivated peers overwhelmed by academic workloads, and individuals who choose indifference over action. We must ask ourselves, are medical students doing enough to overcome the barriers to universal health coverage? The answer is no. To address this, we need to implement incentives and provide recognition to those making meaningful progress. Furthermore, we must foster dialogue, inviting all, whether they agree or disagree, to join the conversation. To all young leaders, let us roll up our sleeves and never give up the fight for our rights. Always keep the global context in mind, and remember that together we can create lasting impact. Thank you.
Thank you, Diego, not only for speaking to your medical student peers, but other youth activists all around the world, recognizing that this call to action affects everyone. So thank you so much for that. Let me return to Dr. Joshi, and you've been a very visible and successful parliamentarian, and again, known as a global activist yourself. So give us your call to action for your fellow parliamentarians.
You're on mute, Dr. Ibrashi, you're on mute.
Okay, apologies. Pamela, thank you so much. I really hope that, again, collectively we can create better and more impactful global health goods for our future generations. As for the call for action, first of all, as the parliamentarians, we are direct representatives, directly elected representatives of our constituencies, and our primary obligation is to listen to our people, to our communities, and to develop policies, budgets, and reforms that will meet their unmet needs. And with the growing voice of young people, young professionals, often united as professional associations, we have a unique opportunity to have roundtable discussions, to discuss their specific legislative initiatives, and to have a dialogue, continuous dialogue, how to improve, how to make UHC work for young people, and how young people's voice can benefit the universal health coverage movement, both at national and global levels. And hereby, I would like to bring the second example that we didn't have time to discuss in my first intervention. Even though it's not related to universal health coverage, it is an excellent example how even one young person can make a difference for others. In Parliament, I was the chairperson of the Education and Science Committee. And one day, I received a letter from a 23-year-old prisoner, Nick Chugoshvili, who was serving terms due to the drug-related crime. And again, that was a clear indication that we have disproportionately oppressive drug policies in most of our countries. This young person was asking for access to distance online education for master degree studies because he had completed his basic bachelor degree. So based on the request of this young person, as the chairperson of the Education and Science Committee, I initiated the legislative reform that introduced online master degree education programs for prisoners. And I had support not only from my fellow colleagues in the ruling party, but most of the opposition leaders. And for me, Nick became also the face of the change that even in the very marginalized and vulnerable situations, you can make a difference.
Thank you once again, and I also appreciate this sharing the successful examples you've had in Georgia, which are very powerful. We've reached the point in our program that we want to engage our audience and be able to answer some questions. So two things, we do have some questions that have come in through the Q&A, but we also encourage you, if you'd like, to raise your hand to ask a question, and we will do our best to juggle those. But let me start with one question that I'm going to direct to Sobita, and the question is that young people represent a significant portion of the population, obviously. How can parliamentarians ensure the youth voices are actively included in shaping UHC policies and health financing decisions? And maybe after Sobita, Mariam, if you would also respond to that.
I think dialogue is very important. Ensuring the youth participation in every dialogue, every conferences, every meeting is very important, and hearing their voice, and also bringing the youth from the diverse background. For example, youth from the marginalized community and the financially very low profile young people. And youth from all the background are very essential in the meetings, and hearing their voice is the key. And out of the discussion, maybe we can get into the conclusion. So dialogue is the only thing, and ensuring the youth space is key, and not as a token representation, but as a meaningful participation of youth is very important. And giving the space and creating a space for the young people is really important. And with this, I think young people can bring new ideas, innovations, and their thoughts and views in the discussion, and that can be reflected into the policies. Yeah, that's from my side.
Great, thank you so much. Next, Dr. Joshi, and then we will hear from Tanatalua Kola Ekanola.
I could only echo the comments from Sobita, and it's wonderful to see young policymakers around the table. Dialogue can truly facilitate not only bringing the different and often seemingly conflicting positions to the common ground and finding a way out of even the most challenging kind of situations for young people or other age groups. And Parliament, not only through the existing committee or subcommittee structures, but through non-formal dialogue platforms provide excellent possibilities for truly meaningful engagement of youth. And again, my appeal to the fellow parliamentarians would be to initiate, not only wait, but initiate actively dialogue with medical students associations, student societies in the diverse fields from the diverse backgrounds, and also facilitate experience sharing in youth-related policies, especially in the context of universal health coverage, both within their own regions and across different geographic locations. Recently, we convened through the Medical Women's International Association an amazing panel on youth-focused policies in Ghana and Nigeria, and you would be surprised to hear the examples of leadership that those countries demonstrate even with extremely limited resource settings.
Thank you so much. I'd like to turn to Tanatolua Kola Akinola, and then we will come to Biokesh again. So if we could open her, yes.
Yeah. Hi, everyone. Good afternoon. My name is Tanitolua Kola Akinola. I'm a fourth-year medical student at the University of Ilorin, Nigeria, and I'd like to channel my question to Mr. Diego. I live in Nigeria, obviously, and we have a sort of institution.
I think we just lost connect. Oh.
Can you hear me?
You're coming in and out. Why don't you go ahead and try?
Okay, good. My name is Tanitolua Kola Akinola. I'm a fourth-year medical student at the University of Ilorin, Nigeria. So I'd like to direct my question to Diego. So generally, Nigeria here, we have a sort of institutionalized gerontocracy. We are ruled by older people who aren't particularly familiar with the challenges we face here, especially as youth and medical students who are passionate for change. How can we leverage existing platforms such as the IFMSA to ensure that we do not get discouraged trying to repeatedly engage with politicians or policymakers who are focused on short-term goals rather than the long-term effects that we youth should be advocates for? Thank you very much. And also, Dr. Jashi, I would like to request special access to discuss the policy you mentioned on youth-centered policy making that happened in Ghana and Nigeria, or maybe after the event. Thank you very much.
Thank you so much for the question. I'm glad you asked this because it's a question that motivates me within my role and within IFMSA to connect with all people of all countries that maybe they feel discouraged or maybe they feel disadvantaged doing so in events or advocacy. It's a long way to go. So we have a thing called the policy documents of IFMSA, where which we can make stances on themes or on topics. And mainly, I want to express to you that the benefit of making sure that we are participating in these processes is that you connect with people, you make real changes, right? So you have to be clear about that, and you must be entertained by the possibility of having met to all people, making real progress and thrive to us all. So my invitation to you and everyone who feel discouraged about this, it's to engage with people with joy. Let us joy this progress. Let us joy this fight of universal health coverage. Do not feel in any way incapable of talking to people, because look at me, I'm from Chile and I'm here talking to very important people that make stances on very important topics. So that's my message to you. Thank you for your question.
Thank you. And let me come back to B, who I think wanted to expand a little bit on the question of involving youth. And also, if you could address another question that just came in about making sure that vulnerable populations are covered.
Okay, thank you. So I'll start with the question, with the previous question on engaging young people in spaces of policy making. I am a strong believer that young people have to be where the decisions are being made. That way they're able to, actively engage. And I believe that current parliamentarians are best placed to support these efforts. So with current parliamentarians working to create opportunities where young people can be elected into parliament, be it through the political parties that they function through, or even collaborating with youth activists, youth-led organizations, they can amplify and create opportunities for young people to be directly involved in legislative processes and decision making. And this way, we can ensure that the policies and health financing decisions that are made are more attuned to the real needs of young people and are extremely real time. So it's not a situation where, we're going back to young people to ask them, does this work for you? But rather young people are in the room actively saying, that these policies that are being enacted are missing X, Y, and Z. These are the other solutions that can be created. These are the ways in which we can allocate funds that will ultimately, bring us one step closer to UHC. And then for the question with regards to ensuring that vulnerable groups such as refugees or undocumented migrants are covered under UHC frameworks, I will do my best to answer this, and I do hope that one of my other panelists can jump in. I think this is somewhere, or this is a space where parliamentarians can collaborate with CSOs that often work in these spaces and often, are directly linked to these vulnerable groups such as refugees and and undocumented migrants. I think that would be a really great place to start by really ensuring that we're leveraging the spaces and leveraging the organizations that directly engage with these vulnerable groups to ensure that their voices are consistently heard, to ensure that the policies that are also being created reflect the needs of these groups so that they're also covered under UHC frameworks. Because ultimately it's about making sure that no one is left behind. And that means that we need to create policies that the directives, the guidelines that sort of govern our healthcare systems are created in a way that they're fully inclusive, regardless of one's background, financial or otherwise. Thank you.
Thank you so much. I think we'll move on to our next question. Oriolua Odutoy, I think you need to unmute probably. Yes.
All right, yeah. Good day, everyone. My name is Oriolua Odutoy. I'm a fifth-year medical student from Nigeria and the vice president of the National Member Organization. My question is more of a question contribution hybrid because I'm someone who's always been passionate about universal healthcare and healthcare financing, particularly in my country that has a lot of people who cannot afford these things on their own. But one aspect that is rarely considered and one that I think needs to be discussed a bit more is that for countries that don't have the best healthcare structures, that is in terms of primary, secondary, and tertiary health institutions, while we solve one problem, while we're working to solve one problem, which is healthcare access, it sometimes leads to another problem of overwhelming one aspect of health of the healthcare tree, in the sense that we have people who have issues that should be treated by at primary healthcare level, going to all the way to tertiary healthcare level that is presenting at teaching hospitals and specialized specialty hospitals with cases that are for lack of a better word common, like, presenting. We have doctors who are supposed to be who are supposed to be working on more specialized cases, having to deal with what I will call as more common cases because of that increase in healthcare. So what I wanted to suggest is that more of a discussion is had on how we can improve not only access to healthcare, but the structure, in the sense that people understand that the primary healthcare is supposed to be the first point of contact, and legislations are made so that people can assess that care at the primary healthcare level and want to go there. Because in my country, we have a lot of primary healthcare centers that are more or less abandoned, dilapidated. People hardly, use these places, and that's what causes the overload on the secondary and the tertiary healthcare centers. So I would like a situation where we move the discussion towards first of all establishing a structure and having legislation back that up. And so when that happens, we have more of a spread of the workforce, people stationed at the primary healthcare centers, people at the secondary, and people at the tertiary healthcare centers. And I think that would sort of even out the workload and make it easy for people who want to access more common things to be able to assess them at the primary level. And I believe that it would help make it easy for the government, whom we are calling on for this year's UHC Day, to be able to disburse the resources that will be needed to give people better access to healthcare. Yeah, thank you.
Yeah, thank you. I'd like Dr. Jashi maybe to respond briefly to these system level suggestions. Thanks.
Thank you. I think, Lua, you raised a challenge that many countries, especially in low and middle income settings, face. Ideally, primary healthcare is the gatekeeper of the health systems, but both from utilization of health services and cost-effective management of the financing, but qualification of primary healthcare staff and quality of primary healthcare interventions that we can offer to our population, that truly matters a lot. We know that immunization, antenatal or postnatal care, they do work well in most of the countries, but we have to invest more in terms of screening programs, in terms of diagnostic capacities, and creating truly effective referral systems that can build trust in the community. So that is definitely a priority that we have to work on in close collaboration with WHO and maybe WHO Academy, that is very much focused on capacity building and qualification of the healthcare workers.
Thank you. Let me now give the floor to Daniel Bith-Dew, and then I would like to summarize a couple other questions as we're probably going to conclude our time for Q&A. Daniel Bith-Dew.
All right. Good evening, everybody. Thank you so much, Dr. Pamela, for giving me the opportunity to add a voice to this critical topic of our discussion. So I've heard so much from my friends' contribution from Nigeria. As Dr. Miriam has said, I think most of what they have talked about is the common problem for the low middle income countries. Personally, from South Sudan, although I'm studying now in Uganda, there are quite a number of challenges that are faced. And South Sudan as a country, for example, is having a number of challenges, is having both political crisis and crisis in regards to finances. So youth actually find it so hard to contribute to primary healthcare access by most of the people within the country. And so the situation is actually very hard there. And I think giving us health medical students access, to add a voice to accessibility of this primary care is a key. So for that, I would just want to direct my suggestion to Diego. As far as IFMSA is concerned, so I don't know how deep, I'm not sure well conversant, although I'm a medical student, with the IFMSA policies, but I don't know, how do you see if maybe the International Federation of Medical Students Association gives maybe an opportunity to medical students in different countries, an opportunity to have maybe like a direct representation in government institutions like parliament, where they can easily have a voice rather than being, kept outside from not being listened to and participate in policy making or advocacy within countries of that nature. Thank you. Thank you.
Thanks to you. Thank you very much for the question. So IFMSA provides a platform that brings us all together to make long-lasting progresses and advances within governments. I will read again this point of this call for action that I just mentioned, that we must raise public awareness through protests, but remember that activism must translate aspiration into concrete policies and institutional reforms. You have to be aware of that. And how can we, within IFMSA, be part in the future of the leaders of tomorrow in the government? So it's not assured, but it's of course a platform where we can be civilized, and we can show to people how we engage, so we can further elect ourselves into places of government, being parliamentarians. I think that there is a story within my country that a president of IFMSA Chile became a congressman, and that gives me a lot of hope. Not because I want to be a congressman necessarily, but it reflects that if we engage in these platforms, maybe you can thrive in real progress in the next few years. So I encourage to you and all the leaders to use these platforms as a way of making real progresses, not to be necessarily a parliamentarian or in government offices, but to make real progresses wherever you are. Thank you.
Thank you, Diego. I hear a budding politician for the future there. Okay. I would like to invite all of our participants on the panel to address a question that reflects several of the comments. And I appreciate everyone putting their comments and questions in. And really it circles back to the fact that we're talking about how critical it is for youth to be part of the conversation with parliamentarians. The questions really are in part saying, how do we take that as a statement and a belief and really turn it into action? Can any of you share, or will you please share examples of how you have made your way to those conversations, how you have gotten the ear of a parliamentarian, or how a parliamentarian has actively invited in a youth representative? Can we hear from you in terms of examples that will give our listeners thoughts about how they might pursue this in their own countries? So who would like to go first? Maybe B, you're on my screen. I'll start with you. We want to also include Sobida and Honorable Khan, as well as Miriam and Diego.
Okay, all right. Thank you so much. Great question. Also interesting, and something that I think we are all collectively still trying to find answers to every day. But for the purposes of this conversation, I think it's very important for us to, one, remember that parliamentarians also have agendas, is, sort of, and they work within structures and within systems, sometimes even governed by, the political manifesto of the party that they're working with. And I think sometimes that can be a great entry point for us to engage with them even before they get into, the parliament itself. How do we sort of engage with them to shift or to insert our agendas for advocacy, in this case, UHC, into the manifestos that they're already building, so that by the time they're getting into, the decision-making spaces, our agendas are their agendas, which ultimately means the decision-making is going to start from the jump. I think also within the systems that are also available, I think it's very important for us to create win-win systems for and I'll speak in my case because I've worked in the youth space and I am a young person myself, is creating win-win solutions for young people and parliamentarians. And an example in Kenya would be, for instance, creating youth desks in Parliament where specifically youth issues or issues raised by young people, such as petitions, came about. So we worked in my former during my time at AMREF, we worked with some of the clerks within the parliament itself to create a youth desk where if young people wanted to raise petitions, if they wanted to raise questions to be tabled within parliament, that could be done. And through, consistent advocacy, we were able to create a space where, sort of create a niche where youth-specific voices on issues of health were able to be raised. And this was specifically to address a challenge where, when we reviewed how many petitions were being submitted to Parliament in Kenya, less than 2% of them were raised by, youth or youth-led organizations. And so by creating this specific space, we were able to sort of solve a very specific problem and create space for, young people to directly engage with Parliament.
Great, thank you for that example. Who would like to go next? I know we're at the end of our time, but I would love to give everybody a minute or so to give us an example. Maybe Sobita, yeah, I think you've just unmuted. Go ahead, please.
Yes, I think it is very important to share this things that what I'm going through right now in Nepal. It is related with the question that you just asked. So existing political force will always try to down the voice of the rising people, voice of the young people. Especially they try to down the young people voice by using any kind of means and strategies. At the moment, I would like to share the things that me and my party is going through. My party president, Mr. Rabi Lamichhane, has been in detention because the government has made a false accusation and they are keeping in detention in the name of investigation, and they're just prolonging the case and investigation time period, and they're not doing anything. They're just keeping him in detention. And we are coming in the street, and we have no choice other than to believe in the system, but system is again influenced by the government because we seems to be very threatful power for them, and that is why they are trying hard to suppress our voice. So they will try their hard to suppress the young people, to suppress the voice of the young people and the rising power. And I think it is very important for people to understand that in democracy, the existing political power and parties will always try their hard to suppress the new ideas. So I think people should be very aware and use their voting power very precisely and with the full knowledge. And I think people should be very ready to change the system with the new power. And I think giving the space to the young people in every kind of platform in a meaningful way and letting them speak is very important. So at the moment, though my party president is facing this kind of hardships, it is very difficult for us right now to get the support from media and the human rights activist and global supporter as well, because we are very new and we don't have a lot of international networks, and I don't know like how we get support from international human rights activists and the people who are looking up to us. So it is very important to support one another globally, because I think in global arena, young people are not given a proper space in the proportion of the population they have in the worldwide context. I think it is very important to speak for one another, no matter where they are, and we need to support one another if they are rising power and doing good. So this is my take. I just wanted to share my thought here.
Thank you. Those are certainly realities that we need to be reminded of. Let me go to Honorable Khan and then Dr. Joshi, and if that's okay, that's where we'll conclude on this final question. So,
Yeah,
Honorable Khan, if
I
you could
would like to,
very briefly.
yeah, I would like to speak about the political system here, where we have the youth wing and the student wing. So within our political parties, we engage with these youth and the students in their colleges, in their schools, create awareness programs for them, have interaction. You have a kind of youth parliament which we engage our youth with. And through these activities, we are able to listen to their voices and take it to the parliament. But at the same time, we encourage these people to come into active elective politics and contest elections. And through that route, they could get into the parliament. And many youth have come in. So that's how we work here in India.
Excellent. Thank you so much. Dr. Joshi.
Thank you. Maybe two key messages: that every country context is different, and young people and young leaders should find the best way to approaching policymakers and collaborating with them. I just saw in the chat a message from Ghana representative. They, despite the number of letters they have sent to the members of parliament, they couldn't really attract the attention. On that front, we would be happy to help through the United Parliamentarians Network. Our chapter chair for West Africa, Akwesena Dansua, is, I'm sure we will reach out to her and facilitate the dialogue. But in any country, you have to find at least one policymaker, and you can find them definitely, who will be believing in the cause. In India, we see that Honorary Fawzia Khan can be, of course, your excellent advocate and partner for the advocacy. And yes, and the second key message is, once you find a partner and listener in the parliaments, that it's their obligation. We don't mean that it's something extraordinary, but in our realities, we don't have often those possibilities. Please try to collaborate and try to find joint solutions. Social activism and activism for health rights or human rights advocacy is, of course, an important part of it, but sometimes even policymakers need your support to find the solution and to reinforce your voice.
Thank you. Excellent advice. Excellent. And so I know we've gone a little bit over, but I think it just demonstrates the enthusiasm and interest in sharing ideas, as well as asking provocative questions to really know what is the best path forward. So I want to thank all of our speakers, our youth advocates, parliamentarians, and all of you who are participants. I regret we were not able to answer everyone's question, but this has been a really inspiring discussion. And again, I think triggered a number of actions that we can not only take, but also hold others accountable to. We know achieving UHC with strong financial protection is not only a political commitment, it's really a moral imperative. So the health of our people is absolutely critical. It's not just a luxury. To our parliamentarians, thank you for your leadership in passing equitable laws and budgets that are critical to UHC. For all of our youth advocates, your voices need to continue to be powerful catalysts for change, and we want you to continue to be those activists that are demanding accountability and action. So thank you, everyone. We encourage you to pursue more information on the UHC 2030 website, along with our civil society engagement mechanism, CSEM group. We want you to stay involved, and we look forward to future conversations where we're able to continue to mark progress of really engaging youth and parliamentarians in our desire to achieve UHC by 2030. So thank you, everyone.
Patrick, je pense qu'on peut fermer le
Très bien,
meeting.
j'attendais. Je vais fermer. Merci beaucoup.
Merci à vous. Très belle journée.